Welcome back. Let's go to mom of two, Jacqueline Cooper, who says she is for the vaccine. Jacqueline, you told me one of your concerns is that you feel like there is resistance to the vaccine in the community, meaning people who are refusing to get themselves, their families, and their children vaccinated. What's your main concern?
My main concern is we look at people in our society and in our community, and we're judging them whether or not they're being safe. And that blows my mind that we're taking something as simple as humanity and making it such a huge variant in our culture. I mean, you look at me, you wouldn't know that I have a sister who has a child at home with childhood cancer, and she can't leave the house because of COVID and what's going on, and she can't have him get vaccinated because of his immune system. And I have to protect myself and my surroundings because I do come in contact with her. And so I'm shamed by other moms, and I'm laughed at for wearing masks in public, but you wouldn't know that unless you knew my situation. And it's frustrating, and it's discouraging, and it's disheartening that people are so selfish during this time, and we have the ability to build up this great herd immunity and to make these great strides to protect those that are less likely to overcome this disease, and we're selfishly just ignoring science blatantly. And I just can't get my mind around it. At what point did we stop trusting the professionals, and at what point did we stop having compassion for each other and empathy? And that's what's really on my mind lately.
And thank you, Jacqueline. Joanne Rupiper, is this something you see about parents really being polarized?
Well, I can understand Jacqueline's point of view as far as having someone in their family with cancer and a compromised immune system, and that is a lot of concern with those people who cannot get the vaccine, or it doesn't work as well because of their immune system. So you do have to do a kind of cocooning around that person to make sure that they don't get sick. And children, sometimes they also feel anxious being out in the world. They're afraid that they might get sick from COVID. So maybe having the vaccine would actually make them feel better and more confident about getting out and going to activities, going to a friend's house.
Thank you. And Jacqueline, tell me the ages of your children.
I have a 3-year-old and a 9-year-old.
And what is the status of the 9-year-old as far as the COVID-19 vaccine?
We just got home on a delayed trip last night. Sorry for missing yesterday. So we have not had an opportunity to vaccinate her yet, but we have an appointment scheduled for this week, and she will have her first dose.
Okay, thank you so much for sharing that with us. We are going to now switch over to father of 6, Brian Dawkins. He tells me he's not an anti-vaxxer, but he's against the COVID-19 vaccine for himself and his children. Brian, what is your main concern? What's your question?
Well, let me preface my comment first by saying that I have nothing but respect for people's decisions regarding masking, social distancing, and whether or not they get the shot. I just believe that it needs to be a personal decision, not one that's coerced. And I do have several areas of concern, but what's most alarming to me is the fact that Congress preemptively indemnified the pharmaceutical manufacturers against civil liability if something goes wrong with the shot. They've actually been doing this since 1988, and another law was passed in 2005 to further protect the drug makers. And what that does is it doesn't protect the patients. So if I or my wife or my children decide to get the shot and then have a adverse reaction, myocarditis, or down the road we find out that they're all infertile because of something that happened because of the drug, we have no legal recourse. We cannot sue the drug makers.
And I'm going to turn to Joanne Rupiper of the Southern Nevada Health District to address that. Joanne, what would you say about Brian's concern?
Right. So for the, I'm the local health department and a healthcare professional, so I really can't say anything about the legal aspect of it. But there are a lot of good information on the CDC website that talks about that and how did that come about and how that process is for those who may experience adverse events.
Thank you so much. And back to Brian here. Brian, could you do me a favor and tell me the ages of your children? Also, a couple of follow-ups here. Have any of them contracted the COVID-19 vaccine, and do any of them want the vaccine?
I'll try to remember your questions in order. My children are 17, 15, 15, one's turning 13 tomorrow, a 12-year-old and a 9-year-old. And no one in my household has had the virus, and no one in my household has any interest in getting the shot, and would rather not wear the masks or following the protocols, although, again, we're respectful of other people's decisions. When we're asked to do those things, we comply. But it's not something that anyone in my household is interested in pursuing.
Brian, are your kids attending school, or what's the situation?
My wife and I educate our children at home, but our children are active in the community. They're involved in several social organizations, and they have continued to be around their peers and adults for the last year and a half without any adverse reactions.
Has any information that you've heard here so far in this town hall swayed you one way or the other? Do you see yourself ever changing your mind?
I'm open-minded. I'm willing to change my mind if facts present that would encourage me toward that conclusion. But no, nothing that's been said here is any different than what we've been hearing the last year and a half, that we should trust the experts and just go with it. And I realize that adverse side effects from vaccines are rare, but as Skylar pointed out earlier, so is death from COVID. So we're weighing one slight risk against another slight risk, and when we choose to get the shot, as I previously stated, there's no legal recourse. While there are injury compensation programs administered by the government, they have very low financial caps that don't measure up to what a lawsuit would result in if something was done incorrectly. So no, nothing's been presented that could change my mind so far.
Okay, thank you, Brian. I want to go back to Dr. E. Could you weigh in on sort of Brian's view here?
Well, again, I'm on the medical side, so in terms of compensation and sort of the recourse piece, I'm no expert in that. But in terms of, science and the experts, I understand that this is a global pandemic and things are continuing to unfold before us, and I love hearing that he's open-minded, because as evidence comes forth and things change and maybe the landscape changes, he might hear something that speaks to him, and I believe he would do what he feels is the best interest of his children, which is ultimately what every parent wants to do.
Thank you so much. Now, coming up, we'll see if any parents on our panel change their minds after this discussion. We are live, local, now.